You take a clinical model that is typically an office visit, and it's a diagnosis and it's a treatment plan. But now we look beyond that to talk about how can an individual or a family work together to tie into what's needed in the community. So the accountable healthcare model allows us to take whole person care to a whole nother level, not just focused on the office visit, but focusing on the whole self.
So we're really excited about our whole person care journey, which includes focusing on body, mind, spirit, and community. And the accountable health community model is an example in the community space of us partnering with different social organizations to support needs like transportation, food, housing, so that we can take care of all of you and not just a particular body part.
At the start of Accountable Health Communities in June here, we screened a patient who flagged for 4 of the 5 health-related social needs. And through that, he did flag for care navigation. It was not just about fixing his medical conditions. It was not just about giving him a phone number to call. It was about really creating that relationship with that patient to say, I care about you and I'm concerned for you, and I really want to do this as a partnership to say, what's your greatest need and how can we help you have the best quality of life? So addressing this patient's social needs impacted his medical care. By building that relationship with him, I was able to see that the provider had ordered a sleep study for him and the patient still hadn't scheduled to have the test done, and it had been a few months. So having that relationship, I felt comfortable enough to say, you know, I see that your provider has ordered the sleep study. I think it's really important that you get this scheduled. Can I help you schedule it? And he was perfectly fine. I was able to transfer him, have him get it scheduled, and he did complete the sleep study.
He has been much more receptive to appointments and follow-up and getting the care that we've outlined that we feel that he needs. And I think that he's been empowered more towards his health.
Just connecting with him really was what was impacting him and helping him to feel that, you know, somebody cares enough about me that maybe I should care about myself and start initiating some of the things that the provider wants me to do. And it was really eye-opening to see where our gaps were in our community and to ask those bigger questions to say, you know, what can we do as a community to get the resources for our patients that they so desperately need?
We were cautious about rolling something out that meant more work for our team. However, when we met with the team and we talked through what this meant in terms of the benefit to patients and families, they said, we don't only want to do this in a small population, we want to make sure that this benefit is available for everyone.
How can I help someone? How can I help my patients? That's why we all went into healthcare. This is a person that I'm talking to, and I need to take the time for them and offer this and ask those difficult questions. Because if we don't ask, who will?